Welcome to Moving Digital Health, a podcast series from Mindseed. I'm your host, Reuben Hall, CEO of Mindseed. Each week, we sit down with leaders and innovators in healthcare to hear their personal stories and explore how they're moving digital health forward. Today, I'm joined by an innovation powerhouse, Travis McDonough. Travis is the founder of Kinduct Technologies, an elite athlete management platform used by the NBA, NFL, and MLB that marked one of Canada's most significant tech exits. Now, as the CEO and founder of Wellnify.ai, Travis is leveraging behavioral science, augmented reality, and gamification to take the data science built for the world's greatest athletes and democratize it for grassroots communities, schools, and public health systems. Travis, welcome to the show.
Thanks so much for having me. Looking forward to the conversation.
With Kinduct, you built the gold standard for elite human performance, helping athletes optimize their training at the highest levels of sport. When you step back after that acquisition, what drove the shift to get sedentary kids and local communities moving through Wellnify?
Yeah, look, I think the first chapter, as you referenced at Kinduct, was an amazing journey. And it was really focused in on allowing athletes to become the best version of themselves. We were literally trying to get them to be 1% or 2% faster or stronger or more efficient. And by doing so, with the whole team, oftentimes that could be the difference that, wins a championship. And while that was thrilling and while that was an incredible odyssey, to do from Nova Scotia, I think immediately after the sale, we realized, as cool as that was, there's a much more noble and scalable mission that is worth putting our efforts, our experience, our passions into. And that was really, how do we help to create healthier and happier communities? So we decided, look, why don't we take what we used to do for the LeBron Jameses and Tom Brady's and colloquialize it, productize it, and above all, democratize it and put some of these tools in the hands of communities to allow them to be the best version of themselves. So I think that's what drove a group of us to bring the band back together and take what we used to do at Kinduct, but scale it properly to create healthier and happier communities.
And what's the why behind that? Like, why is that mission important to you personally?
Wow. I think, first of all, we feel some sense of responsibility to pass on the knowledge that we've accumulated and we've sort of soaked up through osmosis in the professional sporting world. And it would be unjust of us to sit on it. And so the opportunity to be purveyors of behavior change, gamification, and ultimately creating healthier and happier habits that people can instill to give them agency and dominion over their health sort of futures was something that we just felt, really compelled to do. We almost felt like we had some type of responsibility to do it. And we're very hell-bent on making sure that preventative health and wellness gets its day in the sun. Right now, it's often dismissed, it's overlooked, it's underfunded, it's undervalued. And we're on a mission to make sure that, it enters into the decision makers at the municipal level, at the provincial level, and at the national level, because you've heard us use the saying that the time is now to start building stronger fences at the top of a cliff rather than more ambulances at the bottom. And, that's really what we're trying to accomplish here.
Yeah, and you've spoken about that macro shift happening in healthcare away from the acute treatment and towards prevention, and that phrase really helps illustrate it. Why is the legacy healthcare system so resistant to funding that fence at the top of the cliff?
I think it's a lot of reasons. I think, first of all, I want to acknowledge that being a healthcare decision maker, a policy maker, or being in government is not easy. We have skyrocketing chronic diseases, unsustainable healthcare costs. We've got, all of these issues and problems. So they're faced with making tough decisions all the time. I think, however, the problem is preventative wellness sometimes takes a couple years for the seedling that you planted to poke through to turn into the oak tree. And oftentimes that's beyond a normal political cycle. And it's easier for politicians to have a ribbon cutting ceremony when they open up a new wing of a hospital or they announce a new MRI machine, than it is to talk about prevention that will absolutely pay dividends in the long run, but they might not be there to reap the rewards. Look, and I think that the other reality is that people will never know about the surgeries that were not needed because of prevention. They'll never know about the waitlist times you've shortened because people don't need to see a physician. They'll never know about the heart attacks that didn't happen. And that's a problem. And I think we need to start to quantify that, and we need to start to make, decisions that our great-great-grandchildren benefit from. I'm not comfortable handing the receipt of our neglect to our great-grandchildren. And I don't think any of us should be. So, we use that saying a lot that societies grow great when old people plant trees whose shade they'll never lie under. And at the end of the day, that's the decision making that we have to, filter a lot of our decisions through, because the longer term play is where we're going to see the astronomical return on investment as it relates to prevention.
A big shift we've seen in society recently is the access kids have to devices and how much time they spend on screens. I mean, parents and governments are terrified of how addicted kids are to social media and just any screen in particular. Instead of trying to lock the phones away, how does Wellnify motivate kids and communities towards healthier lifestyles?
Yeah, look, I want to first of all acknowledge there is a huge problem with phone usage, and it cannibalizes a lot of our wellness activities. And it's it's an ever growing problem. And I think kids don't realize they're inside one of the most powerful and insidious machines or systems that our planet has ever devised. So I want to make sure that I acknowledge it's a huge, huge problem. However, we are also realistic to realize that, kids will never completely get off their phones. So we want to take something that's historically been responsible for lethargy and turn it into an agent of change. And if we can't get them completely off their phones, let's at least use it as an instrument or a vehicle to help to cultivate healthy habits that, again, give them some structure of health as they build these long-term healthy habits over their lifetime. We've also built very interesting tools inside, the youth versions of our platform where kids can't get access to a lot of their social media apps until they've hit certain step thresholds, activity minutes, done so many community events. So we want to make sure that, that through that sort of Hawthorne effect, that what they track, they're more aware of, what they're more aware of, they're more willing to sort of change the behavior. But ultimately they realize that, doing these things will unlock the opportunity to do things rather than just giving them sort of unfettered access. And I think the other thing that want to make sure we point out that in youth and in adults, fitness historically has been a solo pursuit. It's been an individual journey. That is not the case with what we're doing. Community is at the backbone of, the paradigm here. So you're doing things with your school board, with your class. You are collectively moving towards a North Star that might be how many pieces of litter you pick up. It might be how many hours you collectively volunteer, or it could be something physical like step counting or how many minutes in nature that you logged. But we really want to make sure that it's a collective experience, and there's a lot of interaction with others. And the last thing I'll say, Reuben, is that its goal is never to replace human interaction. It's more to augment and facilitate more interaction. So we're building in the social prescription science into it as well. So there's responsibilities inside the daily quest that make it paramount that you are interacting with your other classmates and your other school members.
So you've touched on a few different ways, though, the app works at a high level. Could you take a little bit more time to kind of dive into some of the features and, exactly, how some of that might work to, to get kids off the couch?
Yeah, maybe even at the highest level, trying to give you like the 30-foot view. I mean, what we are trying to do is help to create healthier and happier communities. And we're doing that by leveraging this AI-driven digital ecosystem that we call a community wellness engagement platform. And what we're doing that is different that you've referenced, we're combining the emerging science of behavior change that everyone's talking about because it's responsible for new habit formation, but we're smashing it together with the fun of gaming or gamification to really reinvent the way that bottom-up wellness programs are being offered. And at the highest level with the federal government, the conversations we're having is, look, one of the things that makes us Canadians is that while healthcare isn't free, it's freely accessible to all.
Mhm.
Yet, when someone wants to stay healthy or prevent disease, they have to pay for it. It's behind a paywall. And that allows for people like you and I who can afford a Whoop or an Apple Watch or a trip to the spa or to the private healthcare facility. It allows us all to get access to that. But the vast majority of people, that's out of reach. So we are trying to remove the firewall and provide the democratized access for people to give them, again, control and influence on how they shape their future. The mission we're on is we're all about allowing people in a community to fall in love with the joys of healthy behaviors to ultimately convert them into becoming a lifetime participant of wellness. That's our ultimate goal here. And, we've touched on the problem, skyrocketing chronic diseases, unsustainable healthcare cost, a disconnected sense of community, 10 million shortfall of healthcare professionals in the next decade. We are convinced, and I know this statement sounds harsh, Reuben, but we are convinced we're witnessing the world's largest self-inflicted serial killing in the annals of humankind. It's almost extinction level behaviors. And because we're in the jar right now, we're not reading the label, but in 3 or 4 or 500 years, we're going to look back at today and go, can you imagine we let this happen to our population? So we do feel some sense of urgency. We feel some sense of responsibility and agency to do something about it. So we have created a highly configurable, white labeled digital ecosystem that connects an organization like a government or a municipality or a school board or an indigenous community or other underserved communities like the menopause community, seniors, rural, but we connect them to their end population where we're leveraging a combination of the science of behavior change and the fun of gamification, really to highly engage the user to allow them to create these healthy habits. And to come back to your question that you asked initially is, how does the platform work? Well, we have two parts to the technology. We have a back end, Reuben, and the back end is where the secret sauce is. We have about 85 different tools and features that we can turn on or off based on the go-to-market population. But we can also take a lot of their existing content that right now resides in a PDF format or sits 6 clicks deep on a website, but we put it into the back end through our highly engaging gamification engine. And then we configure the platform within a matter of hours or days as opposed to months or years. And then we create a unique QR code. And then the individual now at the population level enters into the app, where the first thing they see is something called their wellness quest, which is a action plan. It's about a 12-minute action plan daily where we engage the user under 4 wellness categories: body, mind, spirit, and community. And underneath each category, Reuben, we have a plethora of gamification features that really allow the user to have a ton of fun. So under the body section, for example, we've got about 200 augmented reality movements that through proprietary algorithms in the phone recognizes your movements with about 98% accuracy and then converts them to a live rep counter and then a live leaderboard. So it's almost like doing a video game workout with your community while you're doing this physical activity. So it's a ton of fun. But we have also our step counting. This is where your workout plans are. So that's the body category. We have a mind category because we know knowledge transfer is paramount to creating healthy habits. So people watch a relevant 30-second to 2-minute video, and as soon as they watch it, a little quiz pops up to have literally have fun with transferring knowledge. And then we have a spirit section, which is what it sounds like. It's mindfulness minutes, it's meditation content, it's nature sounds, it changes every day. But what we've recently added, which you might find very interesting, we've added something called community. And why community? We've gone around the world and we've studied the healthiest cultures on the planet, places like the Blue Zones and, the Amish. And the common denominator for these communities was less that they had access to a good life, but it was more these communities prioritize serving other people in their community. So what we've done is we've created intentionality and gamification around pay it forward actions. So if you pick up a piece of litter and you take a picture of it, if you volunteer your time, we have an expanding relationship with some of the largest non-for-profits in the country. If you donate blood, if you buy a local product, you do this not just on behalf of yourself, but you do this on behalf of the community that you work with, that you go to school with, that you live with. And all of it leads to a threshold that if you hit it, you're earning a discount for that community, a discount on groceries, free bus passes, free gym memberships, and other luxuries. So or I shouldn't say luxuries, I should say, things that really drive health and wellness for you and your community. So sorry to give you a long-winded answer to a narrow question, but I thought it was helpful just to give that bit of a backdrop because it helps to frame what we're doing and probably more importantly, why we're doing it.
That's perfect. That gives us a really great understanding from the high level down to the day-to-day interactions of how it works. And it's really interesting how you've tied things together into communities. So right now it's early July, and myself, like many parents, are thinking, "Oh, how am I going to keep these kids busy now that they're home from school?" And I know that the app is available in the App Store, but that you need to be part of one of these pilot communities to be able to use it.
Correct.
So,
we're
I
open
know
to change that. We're open to change that. You probably are aware of what we've done in Texas. And in Texas, they're rolling this out to 3,200 different organizations. So that's towns and cities and districts, but it's also corporations and school boards. But we do have a agreement on the 1 yard line with one of Canada's largest provinces, where we'll be integrating with their primary healthcare app and rolling this out to a myriad of different communities across their province. And we've got 4 other provinces that, I'd say they're on the 5 yard line. So what was once on the edge of conceivability is now in striking distance of making happen and at a national level, which we're really proud of.
And yeah, there's many pilots on the go, like you mentioned, 30 plus pilots around different communities around North America. So from small to large, what are some of the key learnings that you've had from those pilots so far?
Yeah, I think I'll take it. That's a great question. Maybe I'll break that into 2 answers. One is very specific metrics. And even before I talk about metrics, I want to say that the number one thing that we have found is that in this country and in North America as a whole, there is no baseline data in this species of data. So there's no baseline metrics on physical literacy, on step counting in communities, activity minutes, actions of volunteerism, blood donations, litter pickup. That literally doesn't exist up until we found a creative way through this gamified mousetrap to be able to pull in some of those very valuable metrics, which to start gives us a baseline of where we are to know where we need to go. But through the pilots, and the reason why the pilots are so beneficial is you learn something on every pilot. I think we did our first pilot only about a year ago here in Nova Scotia. But we took learnings from that and all the way along, but collectively those 30 pilots have, given and illuminated some tremendous insights on what the platform can do on their objective impact. So number one, we see about on average a 2,500 increased step count per individual before versus during the utilization of the platform. And the reason why that's so important is that for every 1,000 extra steps someone takes in a day, they have a corresponding 15% reduction in comorbidities. So at 2,500 steps on average, you're talking about a 35% reduction in comorbidities, which is about the same impact that a lot of chronic disease medication has. So I think that's really important to point out, and we're really, really proud of that. We're really proud, too, that over 72% of the users go from that were under the 150-minute weekly recommended average to over the 150, which also changes the game on reducing a lot of the chronic disease symptoms. So we also see huge spikes and increase in, again, community actions, everything from picking up litter to volunteering time to buying a local product. So I think we've gestated a lot of the data on our measurable impact, and we're only just getting started. I think the other findings that we've really found have been that to change behaviors, you need community. You need to make sure that you're doing this with other people than just yourself. So I think that's one thing that we're very, very proud of. We've got 2 algorithms in the app. One's called the Personal Wellness Score, which gives you a reflection of your consistent behaviors and tells you if you're trending up or down. But more importantly, we're aggregating everyone in a community's personal wellness score into an overarching proxy called a community wellness score, which has helped the government to illuminate blind spots. So why does this community walk on average 3,000 steps more than this? Or why does this community reach the 150 minutes a week on average and this one doesn't? Well, maybe it's because there's not sidewalks, or there's not enough access to public parks, or maybe there's a lack of programming. So we've really been able to help influence decision-making on infrastructure, on policy and programming. So those are really, really, exciting things for us. But I think, learning the importance of community versus just the individual, making sure that there's motivational and behavior change nudges at the right time based on your preferences. I think encouragement is something that's needed and necessary. So I think these are some fundamental philosophies that we understand now that's going to move the needle on engagement and therefore behaviors.
That's really interesting. Understanding that part of the value here is collecting that data in the first place to establish a baseline, and understanding the difference between these different communities and the opportunities for improvement there. I know you're currently working on publishing clinical research to prove that it costs governments and corporations more money not to use a preventative wellness platform like Wellnify. Is it difficult to, prove that ROI without, longer term, like longitudinal population data?
It definitely takes time, right? And that's the biggest challenge that we face. because anytime, again, you need to show the impact on prevention. Sometimes it takes 12 months, 18 months, 24 months, even longer. But thankfully, we've worked with some very progressive and innovative provinces who were willing to allow us to push our data into their LLMs that have data on hospital stays, ER visits, GP visits, pharmaceuticals, and we're already seeing a positive impact on what the platform is doing on those costs and on those numbers as well. It will take more time, but we're convinced that we will be able to show a enormous return on investment. And if anyone says, "Oh, well, investing in prevention is costly," well, it doesn't even compare to the cost of chronic disease. So we will be able to show, we are 100% convinced that this platform costs the government a lot more to not use than use, and we're halfway there being able to prove that now, which is super exciting for us.
Wouldn't that be amazing to be able to create a new blue zone, based on, what we've learned, what works, and then to make those adjustments on a community level over time, to eventually, get that healthy lifestyle and longevity, as a community.
That's it. That's the holy grail, right? We want to make sure that we create hundreds of future blue zones in this country. And let's make sure we do one first. Hopefully that's here in Nova Scotia. But that would be legacy. That would be impact. Look, we've spent 60 years building a sick care system. What we want to do for the next 50 years is build the best healthcare system, which is the one that prevents people from entering it in the first place. And so we want to make sure that the preventative wellness gets the investment it needs, it deserves. There's no longer a lack of evidence. There's just a lack right now of long-term decision making to invest in this, all to ensure, again, that our great-great-grandkids don't pick up the tab for our neglect.
You mentioned before the paradox of healthcare in Canada being freely accessible, but wellness often hidden behind a paywall. How do you position Wellnify to, become part of the infrastructure for school boards and the public sector to make wellness more universally accessible?
Well, I think this is part of our value proposition, that we want to be the scalable, gamified wellness platform and out of the box wellness strategy for the country. We have scale, we have interoperability, we do integrations with the primary healthcare apps. We have a highly sophisticated technology backend that allows us to understand the data points that we're pulling in, but we also have a highly sophisticated AI engine that delivers very personalized wellness quests based off your needs, based off your interest. And I think the federal government loves the concept that people will have their own strength coach, their nutritionist, their exercise physiologist, and their community motivator in their pocket. And that's going to allow for scalability and huge impact. And look, right now, we know everyone doesn't have a mobile phone, but we should look at India, who provide phones for as little as $8, because they've realized that's the only way they're going to be able to scale their healthcare system. And, other countries like Singapore and Denmark and Finland, and people who have actually proactively invested in preventative wellness and are seeing the return on the investment now. But I think I may have mentioned to you, Reuben, that I've been participating in a group called the Healthcare Transformation Lab. It's been 30 thought leaders from across the country. It's been funded by the Canadian Medical Association, and the folks involved in the 30 are the CEO of the Canadian Space Agency, CEO of the Canadian Medical Association, CEO of the Canadian Nursing Society. We've got three chief medical officers of the largest of the largest insurance companies. We've got a bunch of deputy ministers of health. We've got just leading Indigenous thought leaders, and it's been an incredible opportunity to sit around the table to reimagine what the Canadian healthcare system could look like over the next 30 to 50 years. The people running the process are the same people that ran the mediation process during the apartheid, process. So they also ran the mediation between the Colombian government and the Colombian cartel. So we've met 4 times as a group. It's been intense, but to have such a great sense of dispersed judgment, so people with different backgrounds, different ideas, different thoughts, different thinking, have allowed us to come out with 4 different scenarios that might play out over the next 30 to 50 years. And it's been fascinating to see that in each one of those scenarios, prevention is a fundamental key component. And it's one that's found its way as, a founding principle on how we can reimagine what our healthcare system could look like. And we keep using one lens to think about, and that is, what society and system do we want our great-great-grandkids to live in and grow up in? And that's, I think, helped us clarify what we need and allowed us to make longer-term decisions.
I love that, because as a country and as a society, we need to plan beyond the 4-year political cycle, and just looking at the next term, right? Like, what's that long-term vision for the nation, and then work backwards from there. So yeah, looking forward to seeing what comes out of that group, and over the next few years.
It's been interesting, and to steal a phrase from my mother-in-law, and my mother herself gets a lot of recognition for the impact that she's made, which she deserves. But my mother-in-law, she has influenced my thinking also in a huge way, and she's always said, "Be a good ancestor. Be a good ancestor." And to me, that's really stuck with me, because if we can think about decisions we make now with that top of mind, that's going to allow us to ensure that in 3 generations and 4 generations, we've done the right thing. And hopefully we make preventative wellness literally a public utility rather than something that's only available for the wealthy.
Yeah, you mentioned your mother, who's a great politician for many years, and obviously spent her life in public service. Has that idea of like public service come through you, but almost like through entrepreneurship, right? It's like it's public service through entrepreneurship, not just working within the confines of the government.
Yeah, look, I think it's funny. I mean, it impacts you in so many different ways, right? When you have a front row seat watching your mother chase a big goal that really was monolithic. Again, she became the leader of her party at a time when there was not even a female washroom, right, in the Nova Scotia legislature. So she really, made a big impact on how I watched her chase a big lofty goal. And she taught me so many valuable lessons. But hey, join a cause not because it has a high chance of succeeding, but because it stirs your soul. That was something that's really stuck with me. And service is the rent you pay to others. That's just what you do. And, we have a responsibility to pay it forward. We were lucky enough to sort of be born rounding third base without ever having to hit a triple. And, you can't apologize or feel guilty for the position that you were lucky enough to have. But what that does do is it makes you full of gratefulness, and it makes you full of agency, and it makes you full of responsibility that you can help allow someone else get to third base. And you can allow for hopefully generations of people to, just be able to do really meaningful and impactful things. And that does drive me forward. That drives the whole company forward. Because collectively we all embrace that thought process. And it's what wakes us up every day with urgent purpose. That's for sure.
You stated that this chapter of your life is about human impact more than, corporate share price. What does the definition of success for Wellnify look like over the next 5 years?
We're in business. We need to grow a company that's got a financial backbone that allows us to be sustainable. And so, of course, we want to grow a great company, but that's second to we are focusing in on making an impact and creating significance. And rather than just the share price, where we know we move the needle is when someone comes up and says, hey, my son, who all he did was play video games in the basement, he lacked confidence. He's now fallen in love with the joys of moving his body, and he goes out and he's playing activity with all of his friends, and he's now got a newfound sense of confidence. Or my father was able to walk me down the aisle when he just 8 months ago wasn't able to get out of bed. And at a higher level, we want to make sure that we change the narrative around sick care and that preventative wellness becomes included in the budgets on a go-forward basis. And again, we want people to embrace that slogan that societies grow great when old people plant trees whose shade they will never lie under. And I think if we can have that mentality and philosophy applied to decision-making as it relates to prevention, that's the legacy that we want to leave. And that's, again, I almost think that the word success, we're going to take out of the vocabulary, and we're going to replace it with purely significance or impact.
Well, it's great to hear about what you're doing with the Wellnify, Travis, and how ambitious the mission is there. Thank you so much for joining me on the podcast today.
Really enjoyed it. Thank you so much for having me, and thanks for the important work that you do. I've listened to some of the great podcasts in the past, and they're so helpful to, again, pass important information and knowledge on. And I know you've been a pillar in the community here in Nova Scotia. So again, thanks for all the great work that you continue to do.
And thanks to everyone for listening to the Moving Digital Health podcast. If you enjoyed this conversation, please go to movingdigitalhealth.com to subscribe to the Mindseed newsletter and be notified about future episodes.